Live from Technion webinars with Technion experts.
We respond to stress with sleep. Sleep is one of the most sensitive barometers of our mental life. Recent months showed us that stress can be a universal phenomenon. Our sleep-wake cycle is regulated also by the environment. The light-dark cycle dictates our sleep behavior. What about dreaming? The ability to remember dream is first and foremost dependent on the stage of sleep from which we wake up. If we wake up from a REM period, from a dreaming sleep period, the chances are about 80% that we remember a dream. Usually we dream about things that are important for us during the waking period. And now the events that are most important to us are the pandemic and the anxiety related to pandemic, and this affect dreaming. I think that the number one rule in order to keep sleep as normal as possible is to keep a routine, fill the day with exercise, with light exposure, to continue our routine daily life as normal as possible. And what happens if you find yourself in bed and cannot fall asleep? Don't try to fight it. Don't try to force yourself to go to sleep, because this can be develop a habit. This can develop what we call a conditioning of insomnia. What about a drink before sleep? Once alcohol is metabolized, the metabolites of alcohol keeping you awake. What about sleep medications or sleeping pills? For a short-term period, there is some benefit for sleeping pills, but you have to be very careful not to get to the habit of using sleeping pill for a longer period of time. The consequences of disrupted sleep, the long-term consequences are such that it affects our health. And most importantly, during the pandemic, affect our immune system. When you deal with a virus like coronavirus, you need to sleep.
When we have mass events that impact massive numbers of populations in devastating circumstances, it will appear in our dreams in a way that perhaps we have something to learn from. There have been reports in the general media about people's more vivid dreams, more intensely remembered dreams, not always nightmares. As a clinician at the front line in the critical care unit, I had all the sleep disorders I expected. So the sleep changes I was beginning to see happened in the first 1 or 2 weeks, but in the general population, when I asked my patients, some of them are reporting more vivid dream content. And the impact of this disorder at the moment is only measured in hospitalizations. But the actual impact on society is going to take decades for us to really understand, because everybody here has been affected. On top of that, we're having some of the worst social unrest in living memory. We have now in the United States 110,000 deaths. That is the scale of a genocide. And we may have much to learn about the research that's been performed on genocide survivors and people that have lived through those eras. Part of the anxiety that's on top of all of this is the profound social isolation that many of us have never experienced. These are not normal times. We, as a community, need to grieve and then aim for very small gains. It is a very big task ahead for all of us.
Shattering of our world has to be digested in a way. We have to incorporate all these uncertainties and anxieties in our mental life.